way. I don't think so, pal. That's not how this works.
As a pediatrician in IBCLC, I agree there's a lot of not so great breastfeeding advice out there. And yes, some of it is coming from pediatricians who may not be well-versed in lactation education. Supplementation should never be automatic based on a number alone. We need to look at the whole baby, birth details, feeding patterns, wet and stool diapers, and parent goals, not just a percentage on a chart. Before I recommend supplementation, which sometimes I have to recommend it based on concerning weight trends, I'm always discussing latch, transfer, feeding goals, and pulling them back for weight checks with myself or a fellow IBCLC who does home visits. Now let's hear from Dr. Lauren Hughes, fellow pediatrician, IBCLC, and owner of Bloom DPC, who shares this exact pet peeve when it comes to breastfeeding and supplementation advice.
What drives me nuts is the supplementing for a baby who has lost more than 10% in the first 24 hours after a prolonged C-section, prolonged fluids or something. Because one of my attendings would always say, use your smart doctor brain, and realize that that's not possible to lose actual 10%. Like they are peeing out water weight. Like use your smart doctor brain, and you do not need to supplement for that. And so that was one of the most helpful things, because other attendings that I worked with, they would be like, oh my gosh, they lost 10%. That's the number. And not look at the context of what was birth like, what was the birth weight like, what was the IV fluid, what was like the overall picture, how often is this kid feeding, like what was their 12-hour weight, and like looking at that entire thing rather than just like, oh, 10% supplement. Another is saying that you need to give 30 mLs or X number of mLs after every feed.
Oh my God, yes.
And then if they don't finish it, what are you going to do? You going to drop an NG?
I know, right?
What if they want more than that? Are you going to refuse? Or then not giving an out plan, not giving a way out of this, of like, okay, you're going to start triple feeding, which is I did that for 4 weeks and it is a nightmare.
I did it too. Awful. So many different factors. I mean, I'm also looking at what is the feeding like? Like if the mom's telling me there's great transfer, if I can look and I can see good transfer, some babies could just be slower, and then bringing them back sooner.
Yes,
like
exactly.
You don't have to you could just say, hey, you know what? This is a little borderline. I'm watching this feeding. Let's see you back in 2 days.
We eat different amounts based on our needs, based on what growth we're having, based on our output, based on our, like, there's so many factors, and babies aren't machines. They are humans. Yes. And so it's going to be a range, and they're going to want more sometimes and less sometimes. And maybe you have a kid that takes 3 ounces of breast milk and that is all they ever take. And that is fine. And then you have a kid that takes 8 ounces of formula and that's all they take. And that is